So we're getting this perfect storm of incompetence, arrogance, and desperation to reopen the economy from Republicans that's leading to really, really dangerous stuff. And as you know, or you may know, Donald Trump has been talking about chloroquine with azithromycin as a possible game-changing treatment or cure for coronavirus. And as I've told you, there are some serious side effects. It needs study. It has potential. But some guy in Arizona has now died after taking chloroquine phosphate, which is a fish tank cleaning product related to the ingredient in the medication. It's not the medication. I'll talk to you about that in a little bit. But we now have Fox News propagandist Sean Hannity, who's recommending a cocktail of things as a sort of prophylactic to prevent coronavirus, as much as he seems to be saying it also cures it. And it's incredibly irresponsible and dangerous for two reasons. Number one, when you imply there's a prophylactic for coronavirus, which there currently is not, there's these vague speculation based on very little data. This can get people to behave very irresponsibly and think they don't have to do physical distancing. Number two, you're actually suggesting something that can be dangerous for people to take. Check this out. Sean Hannity did it during an interview with Vice President Mike Pence last night.
Mr. Vice President, I'm holding up a letter, and I'm going to read from it in a second, from a doctor in the New York area. And if I may read from it, he has now worked with his associates, and he has a regimen, hydroxychloroquine, 200 milligrams twice a day, 5 days. Azithromycin, 500 milligrams once a day, 5 days. Zinc sulfate, 220 milligrams once a day for 5 days. This is what he has seen. Him and his team have now treated approximately 350 patients in Kairos Joel, was an area of New York that was hit particularly hard, and another 150 patients in other New York areas. His results: we have had 0 deaths, 0 hospitalizations, 0 intubations.
So he refers to a doctor in the New York area who gave this so-called regimen and treated 350 people in Curious Joel and another 150 elsewhere in New York with 0 deaths. So before we even look at the regimen, bear in mind, first of all, Curious Joel is a Hasidic Jewish community an hour north of New York City. The fact that a doctor had 350, quote, patients in Curious Joel, which has a total population of 24,000, to me that suggests, if this is even true, it's overwhelmingly young people that they are, quote, testing this on. Why do I say that? Hasidic Jews have many kids. They have a lot of kids. So when I hear this was tested on 350 people in Curious Joel, I think these are all kids and young people that would do fine anyway. Plus, it's not even clear whether this was being tested prophylactically. He may be saying a doctor in Curious Joel gave this to 350 people who didn't even have coronavirus, and they've not since gotten coronavirus. That would be very, very meaningless. And lastly, no deaths out of 350 patients is meaningless when you're dealing with a likely real death rate of under 1% anyway. So this is all very useless. But when you look at the so-called regimen, hydroxychloroquine, 200 milligrams twice a day, 5 days, azithromycin, once a day, 5 days, zinc once a day, 5 days. Zinc sulfate is just a zinc supplement. There are a few people who say zinc is one of the few supplements that might actually help prevent the common cold, even though we're not aware of any actual common cold treatment. 1/3 of common colds are coronaviruses of sorts. Most of the benefit of taking zinc seems to be in people who are deficient in zinc in their diet. If you're getting enough zinc from your diet, it's unclear that there's much or any benefit from zinc. Then you've got hydroxychloroquine, which is a drug that you can't just get it. And unfortunately, people are stupidly thinking that the fish tank cleaner with a similar ingredient is the medication. Somebody already died in Arizona from taking that. And then, of course, you've got azithromycin, which is an antibiotic. Taking antibiotics unnecessarily isn't good for you. You also need a prescription for that. So this is just crazy and irresponsible for Sean Hannity to be talking about on Fox News as if it's anything at all, never mind something that prevents or cures coronavirus. Sean Hannity also saying last week on his radio show that he believes vaping may have a protective effect in the lungs against coronavirus. Also, no evidence of that, no good evidence of that. Very dangerous stuff coming from Sean Hannity on Fox News, and this coming during an interview with Vice President Mike Pence. I want to give a quick shout out to one of our sponsors, Vincero Watches. They're giving my audience 15% off your entire order when you go to davidpakman.com/watch. Maybe you don't usually wear a watch and you've been thinking about looking for one to elevate your look, or you've been thinking about replacing the one you have. Check out Vincero. It's an American company. All of their watches are built in small batches from high-end materials. They look amazing. And they look like something you'd spend a lot of money on, but every Vincero watch ranges from $150 to $300. I went on their website and picked out the Kairos in white and silver. Really love the look, the combination of the white face and the beige band. Really love this one. They also sent me the Kairos limited release gold reserve set. Totally different style. This one would make a fantastic gift for a couple people I can think of in my family. Anytime you see me wearing a watch on the show, I'm wearing a Vincero watch. Go through their collection. I know you'll find something you like, and you'll get 15% off when you go to davidpakman.com/watch.